There is currently a fight in the world for recognition of neglected diseases. Chagas disease is one of many. This research proposal discusses and analyzes the ways in which providing up-to-date seminars to healthcare providers can allow us to diagnose and treat cases of Chagas disease sooner. In this presentation, I will be covering an introduction to my research proposal, a literature review of Chagas disease, my research question, the proposed data collection and methods, the participants, a brief data analysis, the anticipated results, and a conclusion. I would like to improve the patient application of medications by educating healthcare workers in endemic regions on how to identify the signs and symptoms, diagnostic tools, treatment methods, and prevention education regarding Chagas disease. Through my research, I have found there is a gap in the knowledge produced in the labs and the actual patient application clinically. As nursing students, we must be aware of neglected tropical diseases as well as all other complications our patients may face. Nurses and doctors should be aware of the signs and symptoms and what questions to ask to identify the presence of Chagas disease. The disease can infect anyone and, if left untreated, has potentially fatal consequences. In some regions, the disease is clinically unknown. Therefore, those who should be receiving treatment do not. By conducting this research, we can help bring awareness to a neglected tropical disease and potentially save the lives of those who are suffering silently. I hypothesize that if we educate the healthcare workers in endemic regions about Chagas disease, we can treat, diagnose, and educate patients earlier. The focus on educating the healthcare team will allow more patients to be diagnosed and will thereby generate greater demand and production of medications for treatment. In 1909, the Brazilian physician Carlos Chagas was the first to identify the disease. American trypanosomas, or Chagas disease, is characterized by a protozoan parasite, Trypanosoma cruzi, or T. cruzi for short. This parasitic disease is common in impoverished communities such as South America, Central America, and Mexico. However, travel and migration has resulted in a spread to the U.S. as well. T. cruzi infects individuals via blood transfusions, vector, vertical transmission, organ transplantation, and laboratory accidents. Commonly, humans are affected by way of a vector bite. T. cruzi is transmitted through the feces of Tritomini. This type of bug is also termed the kissing bug. The carbon dioxide exhaled by sleeping humans attracts the insect, as they often bite near the mouth. The insect then deposits parasitic feces into the wounded skin, causing an infection when the individual scratches or rubs the infected area. How is Chagas disease diagnosed? According to the CDC, Chagas disease can be diagnosed through diagnostic testing, exposure risk, and clinical findings. Blood, tissue, bone marrow, and pericardial fluid are used to microscopically examine for T. cruzi parasite. One test, xenodiagnosis, involves feeding blood of the victim to a healthy Tritomine. In order to diagnose the disease, the insect's gut contents are examined 4 weeks later to test for the presence of the parasite. Immunodiagnosis can also be performed to detect circulating immunoglobulin G or M antibodies, which the body creates to fight the antigens of T. cruzi. Typically, a minimum of 2 serologic tests are performed to confirm the diagnosis of Chagas disease, along with the consideration of exposure risk and clinical findings. These diagnostic procedures are dependent on the multiplication of the parasite prior to examination. The first contact between the host and parasite is represented by the acute phase. The acute phase is often asymptomatic and can last for decades. Therefore, detecting the disease during this stage is rare. Patients face negative outcomes from the disease due to this delay. Patients are not being diagnosed and treated, which consequently limits research. Patients in the acute phase may benefit from medications such as benazidil and nifurtimox. The goal with both medications is to decrease the number of circulating parasites in the blood and avoid tissue damage. Successful treatment of Chagas disease is observed in about 80% of patients when treated during this acute stage. Therefore, early detection allows for the use of effective and appropriate therapeutic measures to prevent disease progression. Following the acute phase of Chagas disease progression, the indeterminate phase is clinically silent. There is a host-parasite equilibrium during this stage in which individuals present with diagnostic evidence of the infection, but remain asymptomatic. Most patients with Chagas disease live in this indeterminate phase. Therefore, early detection of myocardial damage is crucial. Methods such as the transmitral Doppler flow are useful methods to detect cardiac abnormalities. Most cases documented refer to the chronic stage of Chagas disease. This phase is also termed the indeterminate chronic form due to its initial asymptomatic presentation. Signs and symptoms can manifest as irregular heartbeat, congestive heart failure, sudden cardiac arrest, difficulty swallowing due to enlarged esophagus, and abdominal pain or constipation due to an enlarged colon. Cardiac complications allow for better diagnosis, which is why more cases are documented during this stage. Serological tests such as ELISA, IFA, and IHA are often used to diagnose patients in the chronic phase. Treatment includes the previously stated medications. However, these medications are not as effective during the chronic stage. The following research question will guide this proposed study. Why are Chagas disease patients not always being treated and diagnosed? How can we educate the healthcare workers in endemic regions on how to identify the signs and symptoms of Chagas disease? First, I will reach out to 3 different hospitals in 3 countries that Chagas disease is most prevalent. I will then create a PowerPoint and record a Zoom presentation that will be shared with the approved hospital locations. The PowerPoint information and audio will be rendered into the native language of each hospital location. It will be available with or without the audio recording as well. This will give the option of a live presentation by a member of the hospital, as well as the ease of just watching the video. The PowerPoint will contain information and visuals explaining what Chagas disease is, the signs and symptoms, risk factors, how to diagnose, treat, prevent, and educate patients. The hospital staff will set up a calendar with several dates for their hospital staff to sign up for this seminar. It will be mandatory for healthcare workers in partnering hospitals to partake in the seminar. Providing several dates will allow all of the staff to attend and work around their individual and work schedules. Staff will participate in this seminar once a year and will be incorporated into the new hire trainings. Staff will be required to take a short quiz to test their knowledge after the seminar. Healthcare members are encouraged to score a 75% or higher. If they do not, no penalties will occur, but they should be encouraged to review what they missed. For quick access to the healthcare members, it will be available on a YouTube channel. Having access through YouTube will allow healthcare workers to refer clients to watch it if they need more clarification. Clients diagnosed with Chagas disease should be encouraged to share the video with their friends and family to further spread awareness. It will be mandatory for nurses and doctors to attend the seminar and take the quiz at the end. Other members of the healthcare team will be encouraged to sign up as well. However, it is not mandatory as they do not have as much contact with the patients. 3 hospitals in Brazil, Colombia, and Peru will be asked to incorporate this proposed seminar into their hospital. Hospitals in Brazil will include Hospital de Clínicas de Porto Alegre, Hospital de Har, and Hospital Victoria. Hospitals in Colombia include Hospital General de Barranquilla, Clínica de Bosque, and Hospital Joaquín Paz Barrio. Hospitals in Peru include Hospital Nacional de Sur, Hospital Regional de Cuso, and Hospital Regional de Conte de Trujillo. These are all randomly selected hospitals in regions of South America where Chagas disease is endemic. Patients will not be included in the seminar but should be encouraged to look at the video or PowerPoint online in their own time. After completing the seminar, the mandatory quizzes will be gathered. A quiz statistic report will be conducted to determine the effectiveness of the PowerPoint. At the time of the next annual seminar, data will be gathered including how many cases of Chagas disease were documented, the prescription rates of bisnadazole and nifurtimox, and the use of diagnostic blood tests. Bisnadazole and nifurtimox continue to be the leading treatment options for patients with Chagas disease and should be analyzed to see how often healthcare providers started treatment on Chagas disease patients. Additionally, the use of diagnostic blood tests will show how often healthcare providers were able to identify the disease. Monitoring the use of these medications, diagnostic tools, and the number of documented cases will give us an idea of the effectiveness of the teaching seminar. Upon reviewing the data, I anticipate more cases of Chagas disease to be documented. Having current information will allow healthcare workers to identify the signs earlier, allowing for more appropriate and effective treatment and prevention methods. I also expect more demand of the known medications for treatment, bisnadazole and nifurtimox. I expect to see an increased use of blood tests. These laboratory tests allow the healthcare provider to observe the presence or absence of the T. cruzi parasite in the patient's blood. The increased use of both the current medications and diagnostic tools will indicate that providing education seminars to the healthcare members is effective and should be continued. If there is not a change, education should resume for another year. At this time, we will reevaluate what changes can be made in the process of educating the hospital staff on Chagas disease. A substantial knowledge deficit exists amongst healthcare providers and Chagas disease. Consequently, this has potential to negatively affect their patients' health if not recognized and treated appropriately. It is important that nurses and physicians educate themselves on the disease in order to recognize clinical manifestations as well as how to treat, diagnose, and perform nursing implications for those that are affected. Maintaining knowledge within the healthcare realm regarding current tropical diseases will help aid in screening, diagnosing, and treating Chagas disease. If healthcare providers are not able to diagnose patients until the chronic stage, this could severely impact the outcome of the patient and result in increased healthcare due to the chronic manifestations. The use of a seminar as proposed will expand access to diagnosing and treating Chagas disease. It will further establish the rights of high-risk communities to acquire prompt, quality healthcare.